building a better Bay Area. Moving forward, finding solutions. This is ABC 7 News.
Hi there, I'm Kristen Z. You're watching Getting Answers live on ABC 7, Hulu Live, and wherever you stream. We ask experts your questions every day at 3 to get answers for you in real time. Today, we'll look at part of Governor Newsom's proposed budget. How much is going towards education? What are the priorities? And what more can be done to help school districts that are struggling right now? We'll also look at what's being called a national blood crisis and what's being done about it. But first, details on an Omicron-specific vaccine and which current vaccine is best at protecting you against Omicron. There are new debates over masks and how long you can really wear yours, plus an ominous warning about how many will soon be infected. Joining us now to answer our questions, UCSF infectious disease specialist, Dr. Peter Chin Hong. Dr. Chin Hong, great to have you here.
Always a pleasure, Kristen. Thanks for having me on.
All right, we're going to start big picture right now. Omicron, I read, accounts for 98% of U.S. COVID cases now. Look, where are we with the surge right now? Are we peaking yet or close to it?
Well, there's some initial and good evidence from New York that they're starting to crest. But New York is not San Francisco, meaning that we may even crest overall earlier than the duration of time in New York, because we are a little bit warmer. New York is really plagued like UK with a lot of indoor gatherings, really, really difficult to escape that super cold weather. So we're hoping, back to your question, that we'll sort of peak in the next week or two, and then we'll be downhill, hopefully 3 to 4 weeks in descent.
Okay. Of course, the national story, right, we're seeing is that hospitalizations are at an all-time high during the pandemic now. But how is it here? How is it in the Bay Area and San Francisco? Are we running out of capacity, or are we still okay?
We're on the edge. But again, as opposed to 1 year ago or last winter, fewer people in the ICU. So overall, we have about 60 patients, so 60 to 70 patients with COVID. Only 10 of them are in the ICU, and about 30 to 40% of them are coming in for something else and then happen to have COVID. Nevertheless, it's still, we're close to capacity of many services. So I think, especially with people out sick, so that's really what's straining the hospital in this version of the surge.
Okay, so a little bit of a silver lining there if you look deeply at the numbers, but please still try not to get it right now if you can avoid it. Which brings me to vaccines. Big news, Dr. Chin Hong, Pfizer is planning to make an Omicron-specific vaccine. Tell us about this.
Yeah, so basically with an mRNA vaccine, you essentially cut and paste the code of the genetic material for the spike protein that you want. So if Omicron looks twisted, you can just sequence this new thing, make the code for the spike protein that looks different, and make a new vaccine. Pfizer can do that by March, they said, Moderna by fall. But as per your first question, we probably would have been done with Omicron by then. It will only be great as a vaccine, potentially, as if Omicron stays as the only thing in town, which may or may not occur. We may get a new variant that will look very, very different. So some people say, why not just give boosters with the same thing we already have, rather than make a new one?
And that's not unreasonable, right? But when you say, let's say Pfizer will be ready in March, is there an additional approval process after they say, here we are, it's done? And how long does that take? Like, when could it be in arms?
Probably in arms, April. I mean, it's hard to speculate, but you're right. It has to go through a rounds of approval. You have to have data that you probably don't have to have disease data, but at least antibody data. And, that all goes into the consideration before approval, and then the FDA, and then the CDC.
Okay, and of course we'll see if Omicron is still the name of the game by then. But which current vaccine is best at protecting us against COVID? There's some new data out of the UK, right?
Yeah, so when you look at the UK's data for boosting, it appears that for symptomatic infection anyway, Moderna is hovering at around 80% protection. When you look at Pfizer, it's about 60% or so. But they're both really good at severe disease, hospitalization, death, which is close to 90%. So it just depends, and maybe that difference of 8 to 10% for symptomatic infection is not that significant to some.
Okay, Sandra has a question for you. If you got J&J and then Pfizer as a booster? Should you get a third shot?
That's a great question from Sandra. I think most people thought J&J should have been 2-shot dose. So personally, if you can get 3 reminders or 1 shot and 2 reminders to the immune system, that's going to be better than just 2.
Okay. Dawn has a question, which I think a lot of people are starting to wonder about. Isn't it better that most people get this mild variant to help preclude a more serious variant take hold? What do you think?
There's no guarantee that you getting Omicron will protect you against a future variant. But, you know, so that's the question. Will protect you against past variants like Delta? We have information. And personally, I probably would prefer not to get it than to get it at all, because you just don't know if you're going to have chronic symptoms. We think it's less likely. We don't know if you'll be one to go to the hospital. Again, less likely. But again, the risk is not 0. It's just less likely.
Okay. The World Health Organization and the FDA, the heads of those organizations, each gave ominous warnings today that suggests catching COVID seems inevitable at this point. What exactly did they say?
They said that, more than half of Europe would get exposed in this current wave. And the second take-home point is it probably will be disruptive like it is to California and many vaccinated countries in Europe. But the eastern part of Europe, where it's very, very unvaccinated, like 30%, 20%, that they may see serious impact on deaths and serious disease. So that's the question as it rolls over. Remember, South Africa had a lot of previous immunity from Delta.
Yes.
So it may look very different from Eastern Europe.
All right, speaking of South Africa, Daniel wants to know, since we're basing a lot of our predictions off of South Africa, how are they doing now? Is life there getting back to normal?
Yeah, life is getting back to normal. Cases have descended very rapidly. Hospitalizations are going down. In fact, if you're in South Africa and you get infected, you don't even have to isolate. You just walk around with a mask for 10 days. That's the way they're viewing the infection right now.
Oh, okay. That is very interesting because right now, as you know, the suggestion is that you test after 5 days to determine whether you're negative and can get out of isolation. But with testing, it's kind of a mess, right? It's get tested, but it's impossible to get a test. And if you do get a test, sometimes they give false positives or false negatives. I think a lot of people are just super confused. So if you can kind of give us the most practical advice on when to really test and what kind of test to use, that would be great.
Yeah, so you go to dinner and then you hear that 5 other people at the same dinner got COVID. You have no symptoms. Don't test immediately. If you have limited testing, wait 3 to 5 days. You test then. Say you develop symptoms and the test is negative, but everybody else at that party was positive. You don't stop at that singular test. You either do sort of unorthodox throws and nose combined, or you go and try and get a PCR. You don't have to wait for exactly 5 days. Suppose you got the PCR at 7 and it was negative, or the test at 7 was negative. You can exit at 7 days. So it's a continuous exit, but the minimum isolation is 5 days for a credible symptoms that you're waiting for. If you have no symptoms and you're not sure you got it, like you're just testing, you can walk around and with a mask on while you're waiting for the test or the results.
Okay. By the way, the Biden administration is making insurance companies pay for, I think, 8 home tests per person, right, starting this Saturday. So if you buy it this Saturday, afterwards it should be picked up. But, the CDC director, Dr. Rochelle Walensky, today was at a Senate hearing, and she said that rapid tests are not going towards the total case count in the U.S. But aren't rapid tests the majority? And if so, does that mean we're kind of not getting the big picture and the actual infection rate could be way worse?
Yeah, the infection rate is definitely much worse than we're seeing because tons of people are doing rapid testing. But I think what is very accurate is the hospitalization rate and deaths. And I think that is really probably the best measure of how we're doing as a society. The testing curve is also helpful, like when we go up, when we go down. But the absolute number, even though we had 1 million cases one day last week in the US, it's definitely an underestimate.
Okay, I want to talk about masking. We know N95s and KN95s are needed against Omicron, much better at filtering. But since they're costlier, people want to know, if they have one, really how many hours, how many times can they wear them, reuse them?
Yeah, so if you're not in healthcare, you can actually use your KN95 or N95 as long as it's not soiled or broken. Remember, surfaces are not thought to be that important in COVID anymore. But some people, if you're worried about that aspect, you keep a set of 5 masks and you just rotate them. You put one at the end of the hanger coat rack, use the one at the front, and then rotate it. And that gives enough time to get rid of random viruses that might give you the cold or influenza.
Okay. If you're a parent, would you insist that your kid wear N95 all day in class? And if you're a teacher, would you insist that kids cannot be in your classroom without an N95 or KN95?
I wouldn't insist on it. I would recommend it. I think it's tough for kids to wear an N95 all day. It's hard for me. It's smelly and it's more uncomfortable. KN95 is more comfortable. If the kid is not comfortable wearing a surgical mask, I would say, try to double mask it, have fun with it, put a pattern on the second mask. If not, at least a surgical mask. It's not the only strategy. If they're vaccinated, I'll feel better. If there's ventilation, I'll feel better. If there's testing, I'll feel better. So multiple modalities together with the mask gives a sweet spot, not just one thing.
All right, we have about 30 seconds, but Randy's question is good, and I'm going to get it in here. Any new variant on the horizon that we should be concerned about?
No, after the sort of hubbubaloo about the IHU variant in France that everyone sort of dismissed, no new ones yet, but hopefully we'll have a reprieve for a few months, at least if not longer in the US, and we can go back to at least some semblance of more normalcy after the surge.
All right, Dr. Peter Chin-Hong, thank you so much. Always appreciate your insight.
Thank you, Kristen. Bye.
Bye-bye. Coming up next, the impact on schools after Governor Newsom just unveiled his budget with an eye towards challenges brought on by COVID. What happens now? We'll be right back.
In commercial break.
All right, everybody, thanks for joining us today. So appreciate it. Randy, I'm glad I was able to get your question in. Some of you had great questions about the fourth shot. I'm sorry I could not get that in, but as you know, Israel is now requiring the fourth shot and for some people. So I think we'll eventually get to that point. Daniel, you're so welcome. Vivian, let's see if we can look at your question. Your son wore the N95 while you were on the plane. He was getting claustrophobic, made him watch a movie, right? Type 1 diabetic, it was tough to wear the N95. KN95 for school, right. My biggest problem with the N95 is not the breathability, it's actually the straps. I have one of those with the yellow straps and it just doesn't stay on right, it's uncomfortable. But I do like my KN95s just fine. I think that works out well for me. So I'm using that. And sometimes I just use the surgical. It really depends on how crowded the space is, how long I'm in that space. But definitely upgrade from the cloth mask if you have that. All right, everybody. Do we have a lovely weather shot to show folks as I take my water break? Oh, excellent.
1 minute.
All right, we're back. I drank my water in private.
10,
So afraid of spilling all over myself.
7, 6, 5, 4.
How long for this interview?
2.
Governor Newsom just unveiled his budget, which includes more money for education. In fact, K through 12 schools and community colleges will have $24 billion more to spend next year. Is that enough? What are the challenges that need to be met to ensure kids can stay in school, have teachers to teach them, and receive a quality education? Joining us now is the spokesperson for the California School Boards Association, Troy Flint. Troy, nice to have you here.
Nice to be here. Thanks for having me.
Just to let our viewers know, your organization represents the interests of school boards and trustees. There are about 1,000 school boards in California. Troy, Governor Newsom has devoted more money in this budget to schools. Is it enough, though, to meet the challenges in schools right now?
The money that Gavin Newsom has allocated to schools is considerable, and it is a substantial amount, particularly in the short term. Whether it will be enough after these one-time funds expire is an open question, and we don't think it will be, because a lot of schools have staffed up. They've created new programs and services to meet those needs. And those needs are going to persist beyond the next 6 months or a year, because the impact of the pandemic is going to continue past that point. So the question is, once those one-time funds expire in a year or so, will we have to cut programs, close schools, and get rid of staff?
Right. Talk about some of the things that will still require money. Perhaps it was something new that was mandated that's not going away after this one-time money goes away. Like, for example, I understand breakfast or lunch meals at school, right? Or TK for all.
Sure, there are a whole host of programs which are kind of grouped under one umbrella category called expanded learning. So that could be anything from tutoring to before school programs, after school programs, more extracurriculars, longer school days, or having school on weekends to try and recover from some of the learning loss. These have been really valuable programs, but as helpful as they've been, they haven't been enough to blunt the negative impact of what kids suffered when they were off campus and are struggling to reacclimate to in-person instruction.
Yeah, let's talk a little about that, because it just came out a few days ago that the results from the first set of standardized tests that kids took during the pandemic, and they were pretty bad. Correct me if I'm wrong, but I think less than 50% of California kids are meeting standards for their grade level in math and in English. What needs to happen to reverse that, to support those kids?
What really needs to happen is an intense focus over a longer period of time. 6 months isn't going to correct the damage that was done. And really, this is going to be a generational issue, coping with the fallout from COVID-19 and some of the measures that were taken in response to that. I know people don't like to hear that, but that's the reality. And we need to focus really hard on those communities that suffered disproportionately. We saw that not only were scores down mostly across the board, but those communities which experienced the harshest impact from COVID, particularly low-income communities, African-American and Latino communities, had huge drops. And these are groups that on the whole were far behind their peers to begin with. So it's really concerning to see backsliding and that gap widening.
So let's talk about that, because, you know, if you need money in the long term, right? We talked about this one-time infusion. Great, we have a surplus this year. Great, great, great. But funding in California schools is mostly tied to students being in class, right? You get a certain amount of money for each day that a student comes to class. But enrollment seems to be declining in many of these school districts that need the money most. So what to do about that?
So it's important to note that enrollment has been declining for a few years in California because of demographic changes. That's something that's new to us. We've always been a state that's growing. This is really the first time, because we have an older population and because immigration has slowed. And then that's been compounded by the impact of COVID-19, with some families going to private schools, some families homeschooling, and attendance down across the board.
Yes.
And that's part of the reason why there's a bill which is being put forth in the legislature to change the way student funding works to the attendance basis, from the attendance basis to an enrollment-based model, which means that you're funding based on the number of kids that are enrolled, not just the percentage of days they're showing up. So you're not punishing those students who are coming to school by decreasing funding as a result of those who aren't attending school.
Okay. Some school districts, some even here in the Bay Area, are shutting down temporarily, preemptively, as in without health officers' orders, without reaching to the point where they just don't have enough teachers to staff. Under state law, they would lose money. Of course, an exception was made last year, but no longer. So do you think the legislature should provide an exception again for schools to make their own call as to whether they go remote, or do you think that's not necessary or they shouldn't do it?
I think schools should certainly consult with their local county officials, their health officers, but I do think we're in a very different situation than last year. For instance, over the holiday, you saw the governor's office come together with the state's unions and all the education management groups like CSBA, which I represent, we all came together on a statement affirming our intent to keep schools open as long as possible, as long as we could safely do so. It's pretty rare you get the unions, management, and the governor all on the same page, and that shows the level of commitment that we have here. Of course, circumstances have changed, and there are certain districts where more than 20% of their staff is calling out because they either were a close contact or they tested positive themselves. And at a certain point, it does become impractical or actually unviable to provide meaningful education for kids. And in those cases, if the school has reached a point of last resort, then it does make sense to take a temporary hiatus from in-person learning, and kids shouldn't be punished for that. But I think it's a very different scenario, and schools are trying to move mountains to stay open. They would have closed probably a week ago if they were operating under the same premise and the same outlook as last year. But schools are doing everything they can to stay open as long as they can for kids.
All right, Troy Flint, spokesperson for the California School Board Association. Thank you so much for being here and sharing some of the challenges and initiatives being taken by school boards in California. Appreciate it.
Everything.
Coming up next, we'll look at what's being called a national blood crisis, what's causing it, and what we can do now. It involves free tickets to the Super Bowl. Are you intrigued? We'll be right back.
In commercial break.
All right, everybody. Thanks so much for watching that segment as well. Let's see if we have any questions here or comments. Giovanni, you want to thank Hayward for keeping students and staff safe this week? Right, they did go remote this week, and they did talk about how they're not sure about whether they'll get funded for the week, so we shall see. I think $2.5 million is on the line. Christopher, start teaching what is important: science, geography, biology, mathematics, tax, history, literature, civics, communication, balancing budgets. I'm so glad you brought up taxes and balancing the budget. I definitely think financial literacy is a missing component from mandatory education, you know, the core curriculum, for sure. I'm with you on that. So who do we lobby about that? Giovanni, standardized tests are horrible, especially during pandemic. Yeah, you know, that's an interesting point. There are certainly things, there are cons about them, but I will throw this out for your consideration that they are necessary, because without that, it's sort of like turning a blind eye to how much kids are actually absorbing and learning. I don't think it should be used as punishment, but do I think it should be used as kind of a gauge to see if we're doing okay, if we need to provide more support, services, more money, what have you. I think they're important. So that's my personal opinion, but you know, reasonable people can disagree. All right, water break for me. See you in a minute. Much? 3.5 minutes?
10, 9, 8, 7, 6.
Yeah.
5 seconds. 4, 3, 2, 1.
Welcome back. Not only are we dealing with a pandemic, but the American Red Cross says we're in a blood crisis that may put patients at risk. Joining us now is Marcia Antipa, a spokesperson for Red Cross Public Affairs. Marcia, thank you so much for joining us. You're calling it a national blood crisis. Just how bad is it?
Yes, Kristen, first of all, thank you for having me on. And yes, it's something that your viewers should know about. The American Red Cross is facing a blood crisis. In fact, there's been a 10% decline in donations since the pandemic began. There's also been a 62% drop in drives at schools and colleges. So you can imagine the donor turnout has just plummeted. Now, donor turnout and donors fluctuate all the time, but the need is constant. In fact, we've gotten down to a 1-day supply in recent weeks, and that makes it very difficult for the Red Cross to supply hospitals, and doctors have to make difficult decisions in order to decide who is going to get those blood products.
When you say 1-day supply, are you talking about Northern California?
No, we're talking about national.
How about here?
And here it's about the same.
Okay.
We're seeing the same thing, and that's because of the pandemic, many people have not come in to donate. And you know, something else, we do have a staffing shortage, just like every other employer during the pandemic. And so the Red Cross is looking to train phlebotomists who will be paid. They're also looking for volunteers to help staff those blood donation drives and those blood centers.
Okay. I wonder if elective surgeries, you know, we're hearing a lot about elective surgeries being postponed due to the COVID surge. Does that buy you more time at all to procure blood?
I imagine it does, but that is really a question for the hospitals. We provide the blood to the hospitals, and is their decision as to what types of applications they'll use the blood for, what types of surgeries are considered urgent, and that type of thing. But do keep in mind that every 2 seconds, someone in the United States needs blood. It's interesting you should ask about surgeries, but actually there are daily needs for blood. For example, traumatic accidents, sickle cell patients, cancer patients, and even people in childbirth.
Yeah, you're
Here
right.
in Northern California, yeah.
And for a while, you know, demand was down a little bit during the early part of the pandemic when people were not going out, were not engaging in normal activities, but that's back in full swing. So I know the demand is back. So can anyone donate for those who want to help the situation? Talk about that, you know, and what about people who have tested positive and they've recovered? Can they donate?
Yes, what I'm going to ask people to do, because there are many things that affect eligibility. First of all, people need to know that it's okay if you're vaccinated. It's just that the blood drive center will want to know what type of vaccine you had. And all of your questions can be answered by going to redcrossblood.org, because there you can find out your eligibility, go through the process of giving blood, what it involves, the fact that our blood centers are safe, there's social distancing, there's masking, and
Marsha, I don't want to cut you off, but we have about 30 seconds, and I know you want to talk about the incentive you're dangling for people to donate blood right now, and they have to do with the Super Bowl, so tell us about it.
Yes, and go 49ers, right?
Yeah.
No, we just wanted to say that in the past, the Red Cross has done this as well, but if you are able to come in and donate during the month of January, you will be entered in a drawing to get 2 tickets and a trip to the Super Bowl in Los Angeles. So we hope that's enough of an incentive, but I know that people out there also want to give with their hearts and realize there's a need.
So redcrossblood.org is the website. Check it out. Meantime, join us on Facebook Live to continue the conversation. We'll be right back.
In commercial break.
Okay, so Marsha, we're done with the on TV portion, but we're still on Facebook Live where we stream our show, so we can chat we can chat just a little bit more. Okay, so if you donate blood between what period and what period, you're eligible for the Super Bowl raffle?
Between now and January 31st.
Okay.
And
and anywhere you donate blood, doesn't matter?
Anywhere, right. And for the through the Red Cross.
Sure.
And you can also call 1-800-RED-CROSS. If you can't get what you need on that website, 1-800-RED-CROSS, a live human being, a very nice person will answer and talk to you and help you out.
No doubt, very nice. Just to talk about eligibility a little bit more, I know if people go to your website, they can get all the information. And you did tell me that people who are vaccinated are eligible. But what about people who just recently had COVID? Like, what is the rule there?
So I don't have that exact rule, but I can find out for you, Kristen, and get it to your viewers and get it to your Facebook
That's what
page.
I always tell people too when I don't know something. I'll get back to you, and I definitely will. Okay, because people just want to know, because obviously that affects a lot of your potential donor pool right now. So
Sure. The other thing that I'd like,
go ahead.
I just wanted to tell you that in terms of people who need blood, there was a mom here in California who in July of 2020 had an emergency cesarean section. She started bleeding uncontrollably, went through the entire hospital supply of blood. There was no blood within 45 miles. She had to be airlifted in order to get to a hospital where she could have enough blood. So that shows you the level of need.
I sure hope she ended up okay, and I hope nobody else ends up in that situation. Thank you so very much for reminding us that the need is still there. You know, the pandemic is here, but we still need blood. So redcrossblood.org is the website you should check out. Okay, thank you so much, Marsha. I really appreciate it.
Thank you, Kristen.
All right, Super Bowl tickets. Will the 49ers be in the Super Bowl?
5 seconds.
Hope so.
4, 3, 2, 1.
Thanks so much for joining us on this interactive show, Getting Answers. Today, we covered a lot of headlines, including Pfizer's plan for an Omicron-specific vaccine. World News Tonight is coming up next, and we'll see you back here at 4.